It's Thursday, November 17th, 2016, and we're pleased to bring you today's edition of the local news. Suriname will be represented at the APEC Summit. Residents of elderly home Huize Asiana have their own vegetable garden. Dialysis Center Saramacca will hold Information Day. Suriname and Colombia to establish a cassava industry. I'm Susan Mena, and your local news begins now. Suriname is represented in the Asia-Pacific Economic Cooperation APEC Summit. Participant Moreno Jackson of the Young Leadership of the Americas Initiative YLAI program of President Barack Obama was selected to meet the president in Peru. Jackson participated with 4 other Surinamese nationals early October in the program. The program aims to bring together a network of entrepreneurs from Latin American and Caribbean for regional collaborations. During the YLA program, the possibilities have been created for participants to register for a new meeting at the APEC Summit. 170 persons have registered, 60 were elected. Each country could delegate 1 person. At the meeting, there will be an interactive discussion with President Barack Obama and other dignitaries from various countries on entrepreneurship, leadership, and innovation in both the Caribbean and Latin America. It's a privilege to meet President Barack Obama. Moreno Jackson left for Peru today. Residents of the elderly home Huize Asiana now have their own vegetable garden. The action from the community to encourage agriculture is gaining more support from various organizations. Another aim of this agriculture project is to promote a healthy lifestyle to the senior citizens of Huize Asiana. Another advantage of the growing their own vegetables is that the residents will spend less on fruits and vegetables. This garden is one of the many that have been set up recently. At the opening, several speakers addressed issues such as maintenance and conservation to benefit in the short term from the garden. The number of dialysis patients is increasing. In April 2016, the Dialysis Center Saramacca became operational. Glenn Pode, director of the Kidney Dialysis Center Saramacca, says that they are working according to high standards within the center. This is also part of the plan to provide quality patient care. The center in Saramacca treats 4 patients per day. There are many factors that patients need to undergo dialysis. One is when they are prescribed a diet and do not keep it. In short, a bad lifestyle can ensure the people eventually need to be dialyzed. Pode said that the dialysis center in the Saramacca district is not the only one. To give more attention to this disease, the Vacation Dialysis Center in Groningen will organize an Information Day. The awareness should come more within the community of Saramacca. Yesterday, it was again stated how important it is as a human being to follow a diet. Suriname and Colombia are working together to establish a cassava industry. The Ministry of Agriculture, Livestock and Fisheries, LFA, initiates and receives support yesterday of Calayuca Cooperation to develop a framework for the cassava sector. This idea fits perfectly with the strategy of the Surinamese government to diversify the economy. said Kenneth Slaughter, director of the Office of People's Contacts. Worldwide, there is an increasing interest in cassava. These developments have led in recent years to increasingly investments in this product. Also, more and more research is done into the potential of what this crop offers, says Wilgo Bilkerdijk, chairman of the ASFA. Through the processing of cassava, the import of flour can be replaced. This can provide many benefits for Suriname. Cassava has long been grown and consumed. Now the time has come to make the investments for production, says Minister Suresh Algu of LVV. The Surinamese government has committed itself to support the increase in the production of cassava. That concludes our local news for today. Thank you for joining us. Good day.